Okay. Hi, everyone. We're going to get started. So thank you so much for joining today's webinar, which is webinar 5 in the UN-Habitat Masterclass on sanitation and wastewater management in cities and human settlements. So my name is Sam Drabble. I'm Director of Research and Evaluation with WASUP, Water and Sanitation for Urban Populations. And I'll be your host just for the first part of this session. We can go on to the next slide. Thank you. So first of all, to situate this webinar within this wider series. So this is a six-part series which connects to the UN Habitat Global Report on Sanitation and Wastewater Management in Cities and Human Settlements, and to a masterclass that has been developed to share the findings from that report, both through online videos, which are hosted on the UN Habitat YouTube platform, and through this webinar series. And this series is really taking us through all of the core functions of citywide inclusive sanitation as presented in the UN Habitat report. And today we're really excited to address accountability and regulation and what that means in the context of urban sanitation. Next slide. So this is a really complex topic. It's very current, generating a lot of traction globally, including through the recent call to action to strengthen water and sanitation regulatory systems. And we have a fantastic set of speakers to build on that and share their perspective, including from across regions. And I won't introduce them all now. We'll do that as we move through. But Gustavo Saltiel, advisor to the World Bank, he'll be moderating a panel discussion in the second part of this session. We can go on to the next slide. And to present the agenda and the flow of this session. So shortly I'll be handing over to Elizabeth Nahimana from SOAS, who'll be presenting an overview of a global mapping of regulatory structures and accountability mechanisms as presented in the global report. We're then going to hear from Pritam Saha sharing a case study of Dhaka megacity and how accountability is being addressed within that very complex context. From Diego Palania from Colombia, which is another focus location for the global report, before we then broaden this out in the expert panel. Next. Just some housekeeping points to keep in mind. So we have the Q&A function open for this session. Please do put your questions in the Q&A. That's then makes it easier for us to track and ensure that we're responding to all questions, either in written responses or in the panel. Please keep your questions relevant to the topic of this webinar on accountability. You can also, of course, engage through the chat, and we're really keen to hear your comments in the chat as we move through. And this session will be recorded and slides will be shared. So in these presentations, we're going to cover quite a lot of ground, but please bear in mind that all of this material will be shared with all attendees. Next slide. Okay, so with that, I'm going to hand over to Elizabeth from SOAS just to briefly introduce Elizabeth. So Elizabeth is the Research and Knowledge Management Specialist with SOAS, Eastern and Southern Africa Water and Sanitation Regulators Association. She has more than 10 years experience in water and sanitation regulation, including with Rwanda Utilities Regulatory Authority, or RURA. And she is now spearheading the development and dissemination of knowledge-based content on water supply and sanitation regulation at SOAS. And many of you who follow SOAS's work will know she's doing a phenomenal job in that. So over to you, Elizabeth. Thank you for joining us.
Thank you very much, Sam, for this introduction. My role today is to present the key findings from the global mapping on accountability. Next, please. So when we talk about accountability mechanism, registration, regulation, and standards come in the first place because they provide the overall guidance in the sector by ensuring that the roles are clearly defined, ensuring compliance and also protection of public health, also in environment, including sanitation. According to the regulatory landscape study conducted by SOAS, almost all African countries have in place standards for environmental protection. But when it comes to enforcement is another story. Enforcement of these standards is still weak. and not only in Africa, globally. Industrial wastewater regulation also varies widely. It's strong in European Union with clear institutional role, but its enforcement face major gaps, and especially in African countries, this regulation almost do not exist, but where also exist, they still face the enforcement challenges. Next, please. Key performance indicators and public benchmarkings have also been found as another critical set of accountability mechanism, which is used by a number of countries. It's very common in Europe, least common in Africa, but I may mention that Eastern and Southern Africa, we have a number of regulators like WASREB in Kenya, NWASCO in Zambia, EURA in Tanzania that publish the benchmarking or the performance report on annual basis, which also include how the utility have been performing in terms of service provision. So these two sets requires a strong data management system. In some countries, we have those systems. In other countries, we don't. And there is a challenge of independently verifying the reported data by the service providers. The practice is very strong in some European countries. It's still not common in African countries, but regulators are trying. And we can also see some regulators introducing proper KPIs to ensure that also the low-income urban areas receive the sanitation services. This is the case for WASREB that has introduced these KPIs to ensure that the service is expanded to urban poor. Next, please. Another accountability mechanism is licensing and performance contract. These are the tools that regulators use to ensure that service providers abide with the regulations and the standards for service provision. They are very common in Kenya. They are applied by WASREB, by NWASCO, and other countries across Africa, but also in Europe. For example, in Portugal, we have environmental agency, which issues discharge permits for wastewater treatment plants and applies penalties in case of non-compliance. The same case for African countries. When you don't comply with licensing conditions, some penalties are applied. Performance contracts are also very common in sewer sanitation provision, and they are emerging in on-site sanitation service provision with the engagement of private sector. Next, please. Sanitation, when we talk about responsibility for accountability in sanitation, regulation play a critical role. Water sector reform has established regulation in order to oversee both seaward and on-site sanitation service provision by setting standards and hold service providers accountable. So regulation in terms of models varies, and we have three main models. We have regulation by agency, regulation by contract, and ministerial regulation. Regulation by agency is where we have an independent regulatory body that oversees the service provision, while regulation by contract, it's when public authority or institution sign a contract with the service provider. In ministerial regulation, the ministry responsible for water and sanitation also have the mandate to regulate the sector. The experience and what we've seen is that regulation by agency is linked with stronger performance and more robust mechanism. This has been identified in at least 20 African countries, that regulation by contract is actually performing well compared to other regulation models. In other parts of Africa, like West Africa, the independent regulators are not yet in place, but countries like Mali, they are considering establishing independent regulators for sanitation. Next, please. Key roles, as we may know, and as presented in the picture on the right, sanitation involved a number of institutions. As we have different components of sanitation service chain, it's the same as we have many institutions involved. So regulatory roles are found fragmented, typically split between economic and technical regulation and across different institutions, different ministries and agencies. And this fragmentation is very common in on-site sanitation. You may have a different set of institutions involved at containment level, conveyance level, treatment, and disposal. And in some cases, there are conflicts of interest where you may find one institution plays both role of regulator and also service providers, especially in sub-Saharan Africa, where municipalities are responsible for providing the service, but at the same time, they are the regulator of the service provision. So it's kind of conflicting. We also have a number of other institutions engaged, involved. Next, please. We have like environmental agencies that mostly oversees the quality of effluent from wastewater and fecal sludge treatment plants. We have ministries of health that are involved in water quality protection, and sometimes the involvement of these other institutions cause overlapping in mandate. In Europe and Latin America, we have both centralized and decentralized models, like combining national and regional oversight. The independent regulation in South and Southeast Asia is not very common. They use the regulation is typically conducted or carried out by municipalities or different ministries. Next, please. So the key takeaway from the findings on accountability is that we have wide range of regulatory models, but autonomous regulators are really linked to stronger regulation and sector reform, especially in Africa, in Europe, and in Latin America. All countries have had rules for wastewater effluent discharge, but still lack regulation for fecal sludge management. On-site sanitation regulation is still lacking behind in many countries. Public benchmarking using well-defined key performance indicators is also another regulatory tool that is widely used in Europe and Latin America, but also in some part of Africa, and can be extended to improve the sanitation service provision and accountability. Another thing, a common challenge that we've just discussed is that many regulators in low and middle income countries and even in some high income countries lack resources to verify or to check the service providers' performance data. So to conclude, strengthening regulation requires more investment in people, in funding, and also in robust data management system to close the capacity gap and improve accountability, and overall sanitation service provision. Yeah, thank you very much. This is a brief on the finding of the mapping on accountability. Thank you. Over, Sam.
Fantastic. Thank you, Elizabeth, and keeping perfectly to time. So that's I think a really useful overview in terms of how regulatory responsibilities are currently structured globally. All of that information is in the global report, of which SOAS was a consortium partner. Now, we're going to, through this session, intersperse with some quick audience polls, because we want to just test if you were paying attention to that presentation. And we're going to do this very briefly. So we're going to ask you to respond quickly to this poll question. If I can bring this up. So Elizabeth there talked about accountability mechanisms. So which of the following are considered useful accountability mechanisms for urban sanitation and wastewater management? Now you can select as many as you think are correct from this list: legislation, regulations and standards, licensing, tariff setting, compliance monitoring and enforcement, and public performance benchmarking. I'm going to give you about 10 more seconds to absorb that, and then rapid fire select as many as you think are correct. If we can now launch the results, please. Okay, so you have selected, a majority have selected most of these tools, only a minority selected tariff setting. So in the view of the authors of this report, and I think the speakers in this session, all of these could be considered accountability mechanisms for urban sanitation and wastewater management. That includes, of course, regulations and standards across the sanitation service chain, including treatment, licensing as a core accountability mechanism, in many cases the first tool really that regulators deploy. Tariff setting, that relationship, I think that result is understandable and that relationship is more complex, but we're going to try and bring that out in the panel around this relationship between tariff setting and regulators providing a methodology and process for setting tariffs, and accountability. And compliance monitoring and enforcement and public performance benchmarking, certainly accountability tools, and actually very closely connected. A key message in the report is that compliance monitoring is not just about punitive action. It's also around positive incentives, highlighting good performance. Benchmarking is one way to do that. Okay, we can move into the next presentation. So you've seen in Elizabeth's overview how responsibilities are mapped in individual cities. And we want to now give an example of Dhaka in Bangladesh, which is a mega city, over 20 million people, huge challenges around accountability. And this is one of the in-depth case studies in the global report. So I'm going to hand over now to Pritam Saha from WhatsUp, briefly to introduce Pritam. So he is currently Senior MERL International Manager with WhatsUp. He has over 12 years experience in results and impact measurement, specializing in urban planning and development, and has a strong current focus on evaluating water and wastewater projects, including to strengthen sanitation systems in countries across Asia and Africa. Pritam, you have around 6 minutes, and I'll let you know when you have 1 minute left. Over to you.
Yeah, thank you, Sam, for the introduction. So I'm not going into that. Today, I'm here to talk about the wastewater and fecal sludge management context of Dhaka, the capital of Bangladesh, as well as a megacity. Next slide, please. So before we start, let me recall a few relevant numbers. More than 22 million people lives in Dhaka. More than half of the population considered as low-income communities, who often rely on intermittent or alternative services for critical amenities like water and sanitation, and of course wastewater management as well. More than 18 ministries and 50 government departments and companies relentlessly work in Dhaka to provide basic citizen services. Dhaka Wasa is top among those agencies and responsible for providing water and sewerage services to the Dhaka dwellers. A part of wastewater management also falls under their jurisdiction, but managing fecal sludge was not in their mandate. So, until November 2017, no one in Dhaka was legally responsible or accountable for the management of the wastewater generated from the on-site sanitation system, which is used by more than 80% of the Dhaka population. The city corporations were maintaining the roads, solid waste, drains, etc., but they had no mandate to manage fecal sludge and wastewater before the commissioning of the IRF for FSM in 2017. Now, with commissioning of the institutional regulatory framework for fecal sludge management, Bangladesh finally got a regulatory guideline for not regulator, sorry, regulatory guideline for wastewater management generated from on-site sanitation system. A separate institutional regulatory framework has been produced for megacity Dhaka only due to the city's demographic and administrative realities. The other three IRFs or institutional regulatory frameworks are for city corporations, municipalities, and rural areas across the country. In late 2020s, the government has also transferred the responsibility for the canal management from Dhaka Wasa to the city corporations. It is important to mention that Dhaka have more than 50 canals playing critical role in wastewater management. These new pivotal shifts empower the city corporations, but not entirely. There are actors like also known as the Development Authority approval or producing land use plan. These things are critical as enforcement of septic tank or establishment of fecal sludge treatment plants are highly relevant to building approval process and land use planning respectively. Again, Rajuk is not the only department with such critical impact on on-site sanitation components. There are dozens more. Next slide, please. Though challenges in coordination and collaboration among the different ministries and departments remain in Dhaka, the city corporations in Dhaka are making gradual improvements since 2017. Increased vigilance to stop new direct tunnels, conducting campaigns against existing illegal connections, making new action plans to unpack IRF for Dhaka, conducting consulting workshop with multi-stakeholders, different ministries, different departments, even Dhaka Wasa, are some of the mentionable progress made by the city corporations. The IRF has also encouraged the formal private sector actors to engage in vacuum tanker-based pit emptying business in Dhaka, though these enterprises are still working under Dhaka Wasa and city corporations are yet to decide the delivery and the service delivery modality related to pit emptying and establishment of FSTP across Dhaka city. Dhaka currently have two wastewater treatment plants. The latest one has inaugurated recently, so this is not mentioned in the slides, and as well as the research we are referring here, but both under Dhaka Wasa, and there is one FSTP under Dhaka Wasa, which is non-functional due to funding and logistics. So literally, still there is no fecal sludge treatment plant in this city of 22 million people. Like Dhaka Wasa's FSTP, most of the FSM initiatives in Dhaka with the lack of investment, whereas Dhaka Wasa is securing all their sanitation investments in their $2.2 billion sewerage expansion plan, which is used by only 20% of the population currently. Next slide, please. So yeah, we are here in the key takeaways. So the responsibilities for the management of fecal sludge and wastewater in Dhaka is now clear, and the city corporations are unpacking the software parts of the IRF. However, a significant part related to the accountability still falls under a gray area, like the city corporations, while the city corporations must act more efficiently to enforce standards and render services for fecal sludge management and mobilize investment for this regard, the national government must focus on forming a regulatory body for water and sanitation for Dhaka, eventually for Bangladesh, to overcome the institutional challenges related to the coordination and make different agencies and departments properly accountable, and to enable a proper wastewater management system functional for the city of 22 million people. Yeah, I think that's it. Thank you, Sam. Over to you.
Brilliant. Thank you so much, Pritam, for telling us about this very complex situation in Dhaka and again, keeping perfectly to time. Now, Pritam mentioned there some discussions that are perhaps beginning to form in Bangladesh around the potential future creation of an autonomous regulatory entity, which doesn't exist currently. Now, I want to bring up now our second poll question, which connects into this. If we can launch the question. So, true or false, the optimal regulatory model for any given country will be influenced by a wide range of factors. But this is also connecting back to Elizabeth's presentation. In Africa, autonomous regulators have been found to be associated with more active deployment of a wider range of accountability mechanisms. That's relative to other models like regulation by contract or ministry or self-regulation. Is that statement true or false? Again, not going to give you very long to reflect on this, just quickly. And if we can bring up the results, please. Yeah, okay, 84% saying true. And yeah, again, in the view of the report authors and the speakers on this call, this statement is true. And there are two clauses here, and both of them are true. So first of all, the optimal regulatory model for any given country will certainly be influenced by a wide range of factors, and we set those out in the report. And it's really critical to keep that in mind. But that being said, there is a growing body of evidence that demonstrates that autonomous regulatory entities, where they exist, they have been found to be associated with a wider range of accountability mechanisms, and that's set out, for example, in a continent-wide mapping of water and sanitation regulation in Africa. Now, I want you to keep that in mind because we may come back to this and this link potentially between regulatory autonomy and accountability in the panel. And now, as a final contribution before we move to that discussion, I want to invite Diego Palanya from or now consultant, but formerly executive director of CRA. And it's fantastic to have Diego with us. So Diego is an economist from Universidad de los Andes, who studies in environmental economics. He has a master's degree in competition and market regulation from the Barcelona School of Economics, and he has over 20 years of experience in regulatory development and public policy in a variety of roles in the water supply and sanitation sector in Colombia. Currently an international consultant, but previously executive director of CRA, the Water and Sanitation Regulatory Commission. So fantastic to have you with us, Diego, and want to invite you to share some reflections from your experience with CRA in Colombia before we move into the panel. Over to you.
Okay, Sam, thank you. Good morning from Colombia. Good evening, good afternoon, everywhere. Next slide, please. Well, I am going to just make some general points in terms of how in Colombia the regulatory framework for sanitation and wastewater management has been evolving in some principles and criteria that allows us as a sector to have, let's say, good results that, of course, are indeed in need of improving, a lot of improvement opportunities. But during the last, let's say, 30 years since the regulatory commission was set in the institutional framework of our country, well, results in terms of, for example, wastewater management and treatment are very successful. So first of all, let's say that in terms of the report that I found very rich and important, we can clarify that the first pillar angle that we are highlighting here is that there are a clear separation of roles and a strong commitment from the whole model to some regulatory criteria that I will be naming and relating in this short participation. So first of all, there's a clear competence for economic regulation in the Commission for Regulation of Drinking Water and Sanitation, that's called the CRA, as well as there are different roles for the setting the tariffs and setting the regulation in CRA, and enforcement in the superintendents of public services. This is rare, let's say, because both are regulatory functions, but it allows to have like no conflict of interest in the moment of enforcing or regulating. The approach in Colombia, in terms of the report, is, let's say, regulation by agency. CRA is an independent body, as well as the superintendent of public services. And there is the possibility of having regulation by contract. But this is just a discretional decision for the regulated bodies and the municipalities and the districts. The service provision model, and I believe here is the main issue, is that the whole scheme is set up for having a specialized operator that provide the services, and they may be public, private, or mixed entities, but they have to perform and they need to set results as they were an enterprise. So the whole regulation framework is set to control those bodies. I repeat, private, public, or mixed, but they need to perform and to deliver service quality to people and independence of the ownership structure. And I believe that that's the main getting regulatory framework to um, accomplish that is the main accomplishment of our body. And complementary, there's all the environmental regulation that is set by environmental authorities, and it's parallel to economic authorities. And then in these terms of permits and licensing and standards are set there in the environmental regulation, but the regulated bodies need to fulfill those standards and fulfill those processes that are set there. So there are a lot of incentives that are established to encourage the development of wastewater treatment in infrastructure. Next, please. So we have some general criteria that I believe it's the base, and I'm going to make some points there. Is the main uh, access that regulatory framework fulfills. We focus on efficiency, environmental sustainability, simplicity, and financial sufficiency. That I will highlight that it's the full cost recovery principle. It's in, let's say, in the heart of the model in Colombia. So the idea is that the regulator has to assure and guarantee that utilities and that providers do recover all the efficient costs that they are committed to in terms of providing a service. And putting the whole scheme in terms of that commitment is fundamental for results, and I believe it's fundamental for accountability. That is our main message here. Also, there's neutrality, no regulatory framework, arbitrary advantages or disadvantages to anyone, and transparency. That it's in the heart of accountability. So simplicity and transparency are very important for accountability, because people needs to understand what is going on in terms of regulatory decisions, and why is sector results going in some direction. And financial sufficiency, as I said, as in terms of cost recovery, is basic for accountability. So next, please, and I will construct a little bit there, and that will be it. So what I believe, and what we have, let's say, found in our experience in Colombia, is that cost recovery and accountability had like a bi-directional relationship. Once you have effective cost recovery mechanisms in place, it enhances accountability. And at the same time, while you have strong accountability measures, you improve recovery rates. In the first direction, let's say that once you are based on cost recovery contributions and cost recovery mechanisms, then you have a sound financial system with responsibility that will be eager to be transparent and show this good use of resources. It aligns incentives with the revenue and flow of cash flow of utilities, and it will be connected with service delivery. It improves monitoring, signals institutional credibility, and builds trust and willingness to pay in users and in civil society. So once you have cost recovery mechanisms in place, accountability gets strengthened. And in the other directions, once you have good accountability, then this willingness to pay and this connection of users with this service allows to cost recovery easily. And in the other direction, if you have limited accountability, it's what we have observed in our model is that you will find operational inefficiencies, increased costs, and then reduce sustainability, poor alignment between tariffs and actual service cost, no compliance of payment because people is not satisfied with service. There's a possibility of having financial leakages through corruption or weak controls and limited access to financing due to perceived investment risks. So in general, let's say that we have a model based on regulation by agency, an independent regulatory body that has been very eager to assure cost recovery. And by that means, with the full cost recovery approach, you strengthen accountability. And once you get in there, you got like a good cycle that good accountability facilitates cost recovery at the same time. So that will be my main highlights. And thanks a lot for having me.
Fantastic. Thank you so much, Diego. I think you've really shed light on a critical aspect of this challenge, particularly in even more so in sanitation and wastewater management around cost recovery and the connection there with accountability. So we're going to now move into a panel discussion to broaden this out, and I'm going to hand over to Gustavo, who's going to moderate this part of the session. To save time, I'm going to be very brief on the biographies of these incredibly impressive speakers, which feels a bit unfair, but just briefly to introduce. So Gustavo is strategic advisor on water supply and sanitation. He from 2019 to 2024, he was the global lead for water supply and sanitation at the World Bank, leading global knowledge activities and operational advice. That included leading on the bank's work on policies, institutions, and regulations. Mohammed Al-Hamadi, I also want to introduce from Water Sector Regulatory Council in Palestine. And Mohammed has been involved in, or key founder, in fact, in a number of water and environmental institutions in Palestine. He led the Palestinian team in the environmental negotiations in the Middle East peace process. He's worked in Iraq, UAE. He's currently supporting the establishment of other regulators in the Arab region. And finally, Mary Galvin, Dr. Mary Galvin, who's a program lead for research, monitoring, evaluation, and learning with Water Integrity Network, and has over 30 years of experience in water sanitation, climate change, adaptation. Okay, so Gustavo, over to you to take us through wider-ranging aspects of this topic. Thank you.
Thank you very much, Sam, and good morning, good afternoon, good evening, everybody. So let me go straight to the questions. First question to Mohammed Hmaidi. And Mohammed, can you please tell us about WSRC approach to strengthening accountability for sanitation services? And what accountability measures have you found to be most effective? And I would like to ask the panelists to stick to 2 minutes per question and response. Thank you. Over to you, Mohammed.
Thank you, Gustavo. Thank you for having me with this panel. Yes, WSRC in Palestine looking into monitoring almost 320 service providers in water and 76 service providers in sanitation. Some of them are providing post services, but we talk about 76 service providers in sanitation. Now, before we go into what measures are there, the question is accountable to whom? In Palestine, the service providers are accountable to the customer, to the environment, to the government, and to the regulator. Some of the key prerequisites we found are essential to look into accountability. The empowerment, empower the government first, empower policymakers first, because they are the ones who are going to look into accountability. If they are not knowledgeable, it won't make any sense. So empower the government, the policymakers, at the same time empower customers to know their rights and their duties, local NGOs and CBOs. Transparent monitoring, and that's the added value of having independent regulator like the one we have. To make sure that the legal system is complete and is all there in terms of law, bylaws, regulations, as well as systems. To have coordination, partnership, communication with all stakeholders. So these once you have all these requisites, you look into the service provider. Do they have the annual targets, and that's usually approved by the regulator? Do they have policies? Do they have business plans? Do they have accurate data? Once they have these pillars, then we can say that their system is there. Now, in terms of what the council is doing, the regulator is doing, in terms of service provider accountability to customers, we look into tariff reviews, we look into performance monitoring, we look into pollution prevention. But in terms of the environment, we make sure that there is environmental policy at each service provider. For the government, we make sure that we look into adherence to governance principles by all service providers, as well as even by the related institutions. We look into reliable data. We update the Prime Minister once every 6 months on our work, as well as on the service providers' work. The operation inspection, we do that on the spot, and that's not annual, that's continuous. So these are the key issues. But again, to make sure that everybody is empowered, that's a key issue. That there is reliable data and transparent reporting, that is a key issue. These are 2 minutes. Thank you very much.
Thank you so much, Mohammed, for sticking to the time, but a very comprehensive discussion on accountability, different dimensions of accountability, and the role of WRC as regulator. So now let me turn to Mary Galvin from the Water Integrity Network. Mary, based on recent research from WIN, what approaches have been shown to be effective for increasing accountability and transparency in general in the sanitation subsector?
Thanks. I think I should start by saying that the Water Integrity Networks uses transparency, or considers transparency and accountability as pillars to integrity, but then on to effective regulation. And to repeat the point that the previous speaker made of not only being accountable to holding providers accountable, but also being accountable to people for providing sanitation for dignity and health. Our research was looking at integrity risks along the sanitation value chain, sewered and non-sewered. And we recognize that a lot of attention is paid to investment and to regulation of sewered sanitation, and that it was important for regulators to hold providers accountable for sanitation for the entire population, including non-sewered sanitation. So back to those words in community, citywide, inclusive sanitation. So the need for more pro-poor regulatory guidelines so you can reach the people who are poorest and most vulnerable. But also, I think there are 2 issues that are hot on our agenda just for a discussion, is giving people options, sanitation options before curtailing practices in terms of regulation. And also this question of cost recovery and people's ability to pay or use of taxes for cross-subsidization. I just want to raise 5 points that came out of the research that was conducted by WIN with AquaConsult and with the support of SOS in Rwanda, Tanzania, Zambia, Bangladesh. I think these countries are well studied now. But it has to do with transparency around regulatory processes, transparency of the results of regulation. It's been mentioned, collecting and publishing data on sanitation service levels so that we have a sense what progress has been made, what's the coverage, what are the standards. And then specifically, as Elizabeth set out, benchmark reports, hopefully with KPIs, including ones on off-site sanitation, to show off and flag poor performance. And the last point I want to make is that that is important because it raises red flags that need attention. And that might be in relation to corruption, and it also incentivizes utilities to do something about corruption. Thanks.
Thank you, Mary, for raising these very important points, including around your work around the transparency of the regulatory processes. So let me now turn to Elizabeth Naimana. And Elizabeth, in the area of ESAWAS, Eastern and Southern Africa, we have seen regulatory authorities moving beyond the passive development of regulations and standards towards active regulation. Can you tell us about how these regulators are engaging to address the challenges of scaling services, including how they are working to address the financing gap for sanitation? It's a big question. Please try to summarize it in 2 minutes. I know it's challenging, but over to you.
Yeah, thank you very much, Gustavo, for this question. The experience of Eastern and Southern Africa region is that regulating sanitation was lacking until 2020 or so. And where it existed, it was focusing only on sewage sanitation. So in 2019, ESAWAS developed a framework to guide countries on how to initiate regulation of inclusive sanitation. This was a starting point for many countries. They have adopted the framework and developed the roadmap, national roadmap for implementing inclusive sanitation regulation. So to make this work, regulators engaged first in stakeholders mapping, who is doing what and how different interventions can be coordinated. And also countries engaged in mapping sanitation infrastructure to provide the baseline and for an informed, let's say, interventions where the sector is doing well, what we need to improve, and so on. And also, they have moved to the development of regulatory tools to guide the sector, to guide the service provision. This includes specific regulations and guidelines for sanitation, inclusive sanitation. It means sewage and fecal sludge management. This is seen in Rura, in Rwanda, by Rura, in Kenya, in Zambia, in Tanzania. So they have a set of regulatory tools to guide sanitation regulation and improve the service provision, including also licensing framework and on how to engage the private operator. We've talked about accountability mechanism and compliance monitoring. I'm not going to delay on this. Another thing they have invested in is the capacity building of service providers and also utilities, because they have taken up this new mandate of sanitation regulation and service provision. They need to build that capacity to be able to deliver the mandate. Countries like Burundi, Kenya, NWASCO, they have really invested much in capacity building and also local communities on sanitation. Another role that you mentioned about financing. Regulators have established, first of all, the guidelines on tariff setting for sanitation. We have this in Kenya, we have this in Zambia, and other countries are now developing those guidelines and trying to come up with the appropriate model to finance the sector. They have also introduced some innovative financing mechanisms like sanitation surcharge introduced in Zambia, where there is a certain percentage on water bill that is going to the water utilities to ensure that the finances from that sanitation surcharge is used to extend the sanitation services. There is also private sector engagement in terms of financing, enhancing financing, because these private operators bring in expertise, but also investment funds. Another key point, which is not found in passive regulation, is compliance monitoring and enforcement. There are really mechanisms to ensure that service providers comply with regulation, comply with conditions of licenses in terms of sanitation service provision. Thank you.
Thank you, Elizabeth, for this very comprehensive overview, including the evolution of regulation of sanitation services. And since you talked about private sector providers, this takes me to Diego Polania. And I would like to ask you, Diego, if you can briefly comment on the role of the Colombian regulator, CRA, on facilitating the incorporation of private sector participation and private sector financing in the provision of sanitation services in Colombia.
Yes, of course, Gustavo. Thank you. Well, as I mentioned before in my participation, our model is set to bring, let's say, predictability and clarity and transparency to all participants. So once you have a regulatory model that allows for full cost recovery and that allows for, let's say, predictable and long-term rules and regulations, then you are setting the incentives for the private capital to participate on the market. And at the same time, in terms of accountability, as a regulator, you have to set clear KPIs and benchmarking indicators for all those capital investors that participate on the sector. So it's like a balance when you set clear and predictable rules that allows for cost full recovery, and that full cost recovery has involved a competitive discount rate for the investments, and at the same time you uh, ask for information and fulfillment and compliance of KPIs, and you set and you get that to the civil society. And this goes. There was a question in the board. This goes to all kind of technologies. So we have the possibility of allowing something we call differential schemes. This brings, for example, on-site sanitation to the picture. Of course, we try to set rules that are adaptable for a simpler and let's say not as complex model, but to have the same incentives and the same approach for different kind of solutions. So I believe our model is set to allow private investment and to enhance private investment since the beginning. And what works there is the commitment to, in long term, bring full cost recovery, clear rules, clear roles, and to be committed with it. And that will bring us to the next discussion when we get to it, and that is the independence of the regulator, because the investor has the trust that rules are going to be there for a long term, so it's able to invest and make these huge infrastructure investments in the long term.
Thank you, Diego. Very important points on some of the key features of the Colombian regulatory system that encourages private participation. So let me go now to a question in the Q&A section from Mike Pusti, who is asking about the role of the development banks. And Mohammed, if you allow me to depart a little bit from some of the issues we discussed before with you, if you, given your experience working with different donors, in particular with development banks, what would be your reflections in terms of the role and the support from development banks like the World Bank and other development entities in supporting regulatory agencies to create the conditions for expanding sanitation services. If you can reflect on that. You're muted, Mohammed.
Thank you very much. Yes, there is a role for the banks. We be always saying that service providers' role is not only service provision, but be part of the sustainable development goals that the country has approached. And to move into a green economy, a circular economy, that of course requires know-how and requires financial support. And in Palestine, the local as well as international banks, donors are the key supporter of circular economy, of green economy, and being part of the sustainable development goals to be played by the service providers. So they have a role in Palestine.
Thank you, Mohammed. Thank you very much. Let me now move to Mary Galvin with a question, and may I ask you to respond, if possible, in 1 minute, on what do you see, what WIN sees as the role of regulators in contributing to monitoring corruption in the sanitation sector, or if not monitoring, increasing transparency, the other side of the coin, if I may.
To say it in a few minutes, I think, or a couple minutes, I think 1 minute, you'd better read the report. But no, there's a set of recommendations, and it has to do with monitoring for integrity and with integrity. So the corruption is also possible within regulators, or is the integrity risks. And so some of the things that come up are, regulatory functions being well defined. But to sort of jump into the question, financial and political autonomy is a key question, but it is particularly relevant to corruption, because if there isn't adequate capacity to give the function teeth, and if it's open to political capture or capture by the public or the private sector. So that's sort of a integrity or regulation with integrity. If it's for integrity, and I know I don't have time, there are broad and specific regulatory mechanisms, and we know a lot of those, but it's key that they're taken into context. I've been so pleased here to hear about all these different contexts, because that really sets out the difference of what mechanisms you can create, and being able to monitor those for corruption and to adjust them is very, very important.
Thank you, Mary, and also for a very important point that you made. Many important points in 1 minute, but one in particular, you said for and with integrity. It's regulating for integrity and with integrity. That is not always warranted, right? And it's very important to highlight that regulators should regulate with integrity. Okay, we may extend, if Sam agrees, and the panelists, for a few more minutes after the hour. And let me go to a final question to all the panelists. Your reflections, if possible, again, and apologies for that, in 1 minute, on the issue of independence and autonomy of regulators, and also, if you can, any of you who would like to reflect on a question by Robert Gacovia. Hello, Robert. A great question about self-regulation. What is your view on the use of self-regulation tools by service providers, regulators, and governments? So who would like to start? Let me go in order as I see you on my screen. First of all, Mohammed, on autonomy, independence, and possibly self-regulation. You're still muted, Mohammed.
Thank you. Well, we are completely independent, and we already reported Prime Minister. That has created some acceptance by service providers, by the customers, and transparency is always an issue that we talk about because we are independent. That can have a setback in terms of financial sustainability, and because that all depends on the economic situation of the country and the ability to pay fees. but still being independent, that is a key pillar for accountability and for sustainability. And even in conflict areas, being independent, you are people look at you are not biased, neither to the government nor to donor. So they have some even respect, and you have a place within conflict areas and conflict zone and giving conflict timing. So that's where independent being really something reasonable. Now, in terms of self inspection, as long as they have the know-how, that's fine. But at least they have to show their report to somebody, which should be independent. So I would say that even if you have independent regulator, there has to be some self-inspection within the service provision. Thank you.
Thank you, Mohammed. Elizabeth, your reflection on autonomy and eventually self-regulation from Eastern and Southern Africa.
Yeah, thank you very much. I think the independence of regulation is sometimes misunderstood as if regulators have to work in isolation from other institutions. When we talk about autonomy of regulators, it's to do with independence in decision making, independence in financial and management of the institution, because there's no way you can enforce regulation, enforce standards if you are depending on somebody else. So it's about decision-making independence without interference from the third party or external party. But in practice, this is very challenging, even where we have what we call independent regulators, because sometimes we see an interference, political interference. For example, the way the board members and staff, management staff are appointed, they are appointed by the government. It means there is a hand of the government in the regulation, and the decision-making is somehow going to be diluted. And financial independence. Some independent regulators receive finances, budget from the government. And sometimes this hinder or delays the regulatory intervention because they need to depend on the government. Tariff setting, there is always, in most cases, the interference, political interference. For example, the regulator find it necessary to raise the tariff, but because next year there is election, the big boss says, no, you can't raise the tariff. We are not going to get the vote, you see? So in practice, even in countries where we have independent regulators, the independence is not fully, we don't have that full independence of regulators. I don't have much to say on the self-regulation. What Mohammed said, that institution need to report to someone. There's someone who appointed that self-regulation. So it has to be accountable to that institution. Thank you.
Thank you, Elizabeth. Mary, you already mentioned the views of WIN on the importance of autonomy and independence. May I turn the question and ask you if we have any hope, let me put it in those terms, in those situations where the regulator or the regulatory system is not legally totally independent, is not regulation by agency, do we still have hope? And I'm sure WIN has some recommendations in those cases as well.
Of course, we have hope. I think that, there's a lot of evidence that the independent or the autonomous regulator is a positive way to go, but it doesn't mean that the other forms of regulation don't have hope. The issues for us are really about having the capacity to and the teeth to hold providers to account and avoiding capture. And Elizabeth outlined a lot of the options with avoiding capture, with the who provides the finance and who appoints the head of regulation, et cetera, et cetera. But in terms of that hope, last thing, it's people who are sitting around the table here and who are so committed to these issues. It's people, that I'm looking at on the screen who really are the sort of champions of integrity and are trying desperately to make this work in a number of countries. And I think that, we all have to work together in the same direction and keep these sorts of discussions open and transparent so that it can move ahead.
Thank you, Mary. And thank you also for highlighting the importance of capacity building and also leadership, which is what these people, these panelists bring today, and many of the participants as well. Thank you, Mary. Diego, final reflection. CRA is a clear case, CRA Colombia is a clear case of an independent autonomous regulator. So I would like also to ask you to reflect in 1 minute, because you're also working in other countries in Latin America and around the world. What do we learn when you compare the 30 years experience of CRA Colombia with what you have seen? You have recently worked in East Asia and the other places in the Caribbean. What can you, when they call CRA Colombia to advise them, what is the 2 things or 3 things you would advise them beyond the legal framework to strengthen their autonomy and capacity to regulate and to make decisions beyond the government's requests?
Okay, thank you. So that's a big one. I believe I will build in Elizabeth's answer. I think the first message is independence and autonomy is not isolation. You need to be articulated and you need to be part of the public policy objectives. Even the most autonomous regulator has to perform in the environment of the public service. So that's very important, because if not, the public policy is going to be an obstacle for achieving results. So you have to be coordinated, articulated, and you have to, for an autonomy regulator, you need to think in long term. The main idea is to be predictable, to be certain, and to think in long term, because what you are trying to set is rules and regulations that are not going to be going back and forth in terms of administrative changes. And that is what builds trust for investors and for people. So all the time, a regulator faces the challenges of political intervention and political yeah, heavy intervention. But the idea is to build on long-term rules, and the best way to do that, and that will connect with what we are discussing here, is to have good information. Because once you have a process and a protocol that makes decision based on information, based on KPIs, based on good data, then you can manage that, you can handle that. So, and that brings transparency and that brings accountability. So at the end of it, it's a whole package that of course you need to manage and to deal with intervention from political side and from utility side. But with good information and with protocols of decision making, things may be easier to set rules that last in long term. That's the main message. Yeah.
Thank you, Diego. I will come back to that in a minute. So let me close the panel by thanking everybody for your excellent interventions. My apologies for the limited time. This doesn't do justice to all your contributions. But let me, in a minute for myself, let me try to summarize, the main takeaways and conclusions. First of all, of course, thanking all of you, the speakers and panelists, for the excellent presentations, as well as Sam from WUSUP for coordinating the session and the organizers. My main takeaways from the presentations, the excellent presentations and panel discussions. 1, regulatory models drive accountability effectiveness, and we talked a lot today about the best model or the model that drives or contributes to accountability, which is regulation by agency, and there is sufficient evidence to conclude that. So the importance of the regulatory model to drive accountability of sanitation services. Second, institutional alignment, creating better incentives as demonstrated by the case of Dhaka, but other cases as well and mentioned by some